Well, good afternoon, everyone. Thank you very much for joining us for today's edition of the bi-weekly COVID situation update. I'm hearing just a bit of an echo. Hope that's okay for everyone. I think we're okay. Thank you so much, as I mentioned, for joining us. Very pleased to have with us our board chair and deputy warden of Peterborough County, Andy Mitchell, and our medical officer of health, Dr. Ian Gemmell, as well as Donna Cherapy will be joining us, and she's our director of public health programs. Thank you. So as we get underway, we will start with a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so now I'd like to invite our Board of Health Chair, Andy Mitchell, to start us off with some opening remarks. Please go ahead, Andy.
Thanks, Brittany. The vaccine effort in the Peterborough Public Health area is continuing and will ramp up and be operating on multiple fronts. First, we will continue to reach out to the approximately 5,000 of eligible local residents needed to reach our 90% objective who have not yet begun the immunization process. Please, if you are eligible to be vaccinated, do so as soon as possible. Second, we have begun to administer third doses to specifically identified populations. If you are an individual within one of these specified categories, you are able to present yourself at any one of our clinics. Please seek guidance from your healthcare provider. Third, we anticipated that at some point, Health Canada will approve a vaccine for children aged 5 to 12. In our area, there are approximately 9,000 eligible children, and our vaccine effort will be a significant logistical challenge. As the largest group of unvaccinated individuals, our success in this endeavor is critical to reaching herd immunity. Fourth, we will soon begin the annual flu vaccine. Most will be administered by local pharmacies. However, public health will be administering flu vaccine in certain circumstances. Remember, health authorities advise getting a flu shot and a COVID vaccine at similar times is considered safe. Fifth, public health, together with our primary care providers, continues to administer its normal program of vaccines, many of which are required in order to attend school. These efforts are being complemented by numerous approaches to encourage people to get their shots, These efforts are being complemented by numerous approaches to encourage people to get their shots, including institutional, government, and private sector vaccine policies that include a mandate. It is encouraging to note that where these mandates have been in place, the take-up of vaccines has gone up, and our goal of herd immunity has come closer to reality. Part of this process is a need to produce proof of vaccines at numerous venues. Please remember that staff at these locations who are requesting your documentation are simply doing their job. I know it can be annoying for some, but please be patient and do not direct your frustration at staff. Please treat everyone with the kindness and respect everyone deserves. Finally, as important as vaccines are, it is also important to continue to practice important public health measures. Remember to wear a mask where required. Respect capacity limits, adhere to gathering sizes, practice good hand hygiene, and if you are sick, stay home and get tested. To all those who have been stepping up, getting vaccinated, and practicing public health measures, thank you. Everyone, stay safe, be well, and in all things, be kind. Thank you.
Thank you very, very much for that, Mayor Mitchell. All right, so let's have a look at what the numbers are telling us. So to lead us through these next slides, I'd like to invite Donna Cherpe. Come on up to the mic.
Yeah. Good afternoon, everyone. So starting with a situational update, I'd just like to compare the data shared 2 weeks ago, and our numbers today are doing better overall, but we are still following 20 to 30 new cases that are being reported to us each week. We are currently following 18 active cases and 132 close contacts. Unfortunately, there is no change in the total number of local deaths, which remains at 23. Next slide, please. And here you can see by looking at the weekly case counts how thus far the fourth wave is less severe locally than the last two waves, but it does appear to be sustained. Bending the curve with the Delta variant is going to continue to take a concerted effort in our community, with emphasis on vaccination and continued implementation of public health measures. Next slide, please. Just want to show you this slide to compare local case rates from September and October last year to the same 2 months in 2021. And here you can see that even with our local vaccination rates, that there are more cases being reported to us now than last year when we didn't have the vaccine. And that is the effect of the Delta variant, which is twice as transmissible as the variant circulating last year. Next slide, please. And this slide shows you the age groups of newly reported cases since September 20th of this year. And unlike earlier in the pandemic, when 20 to 29-year-olds had the highest number of cases, now it is our youth under 20 where we are seeing more cases. And that's especially true among those under the age of 12 who are unvaccinated and unable to be vaccinated at this point. Next slide. So it gives me great pleasure to report that we currently have no active COVID outbreaks, in any facilities in the community. We do continue to see individual cases in local schools. However, at this time, there is no evidence of transmission within these schools. Planning is actively underway to vaccinate youth aged 5 to 11 as soon as Health Canada approves the Pfizer vaccine for this population. And as mentioned earlier, we have approximately 9,000 local youth in this category. The next slide, please. This map, which you're now quite familiar with, shows you Peterborough's weekly case incidence rates over the past 14 days as it compares to the rest of the province. And starting to the right of the slide, you can see the weekly case incident rates. For the period ending October 16, it decreased slightly to 12.2 cases per 100,000, which is down from 14.9 cases per 100,000 2 weeks ago. The provincial rate is 19.6 cases per 100,000 over the same period. The next slide. And these maps show the same information from October 5th to October 19th. So you can see the change in case incidence rates over the past 14 days across the southern part of the province. And the map is showing case rates over a longer 2-week period when we had higher case numbers. So our region is shown in yellow. So for wastewater surveillance, recent data continues to be very encouraging. This graph shows the last month, and the red bars represent Peterborough's wastewater treatment plant, and the blue are Millbrook's wastewater testing results. And both indicate very low levels of virus being detected. And there was no signal at all from the Millbrook wastewater yesterday, which is also very encouraging. On this slide, we're showing the current vaccination data as of the end of yesterday's clinics, and just like to invite you to look at the number in the orange box at the top left of the screen that shows that nearly 230,000 doses have been administered locally by nurses, physicians, other healthcare workers, and pharmacists. And this is a remarkable number in such a short period of time, and just like to thank our dedicated team of immunizers across our region for this impressive accomplishment. And thanks also, of course, goes to our residents who continue to step up to get vaccinated, so we can all start to experience the benefits of herd immunity. And starting with our youth rates on the left, you can see that 85% of those aged 12 to 17 have received their first dose, and 78% of youth have received both doses. And this means that the percentage of fully vaccinated youth has increased 4% from 2 weeks ago. The right-hand chart shows the proportion of eligible residents, that is residents 12 years of age and over, who have received the vaccines. And these rates have increased as well over the past 2 weeks, and now 86% have 1 dose and 82.3% have received 2 doses. We continue to run walk-in clinics at the Healthy Planet Arena, and for the rest of October, each Monday, Wednesday, and Friday. And today, staff are also out in Ennismore. So please visit our website for regular updates on upcoming clinics throughout the city and county. And also remember that many of our local pharmacies continue to offer vaccine as well. Thank you.
Thank you very, very much, Donna, for that. So now with a few comments and analysis of our current situation, I'd like to invite Dr. Gemmell to share a few words.
Well, thank you, Brittany, and hello, everybody, and thanks for attending again today. We really value and appreciate your assistance in getting this information out to the people of our communities here. And today I'd like to start off by discussing the letter of instruction, which you heard about last Friday. We sent that out through our communications people. And this is for a revised letter of instruction for sports and recreational facilities regarding the additional requirements that we are going to put in place in addition to what is required by the province of Ontario. We are expanding it to include all people who are eligible for vaccine. That's people aged 12 and over, who are either officials, coaches, volunteers, or participants, and that participants is the key part of it. The rationale behind the change is really very simple. It's all about protecting our kids and ensuring that they and everyone around them are fully vaccinated, because that's the way they're going to stay safe. That's the way they're going to reduce their risk of becoming ill with coronavirus. And from their point of view, that's the way they're going to diminish the disruptions that could occur if there are outbreaks around sports facilities, and we know that happen. Our local policy aligns with similar policies in several other local public health agencies across Ontario, such as Toronto and York County. We know that others in the GTA are going to be going this way, and there are others across Ontario, such as Huron-Perth, for example. And this requirement, and that is knowing that the vaccine is required to participate, will make it easier, we think, for sports leagues with teams that move throughout the different regions of Ontario. If everybody assumes that wherever they go, they need to be immunized, it'll be clearer for people. They will diminish, we believe, the inconsistency of, oh, you have to be immunized here or not immunized there or whatever. So we're hoping that that will be a benefit of one of the benefits of this change. And since immunization is required in many other settings, such as restaurants, other public venues, you know, with the QR code that's coming into its launch tomorrow, it provides a consistency of approach that we feel will be, again, helpful to the population to understand. Fortunately, our youth age 12 to 17 have really good immunization rates. You heard that from Mrs. Trippier just a minute or two ago. 78% fully vaccinated, 85% have received their first dose. And we're working really hard to continue to get those rates up. Requiring recreational facilities to check the proof of immunization is an important part of the wider coordinated approach to protect residents in high-risk settings where coronavirus transmission is more likely to occur. And as I said before, we know that it can occur in these settings. As Mrs. Trippier noted earlier, the rates of Coronavirus in those under 20 are now higher than earlier in the pandemic, which is worrisome, and another reason why we want to do our best to protect these kids. And as I mentioned, other regions such as Ottawa have experienced cases in recreational settings that then spread to schools, and then we've got the disruption not only in the sports areas but also in the schools. We expect that the strengthening of vaccination requirements in sports facilities will go a long way to preventing coronavirus cases in our youth, just when we need it the most. And as well, we know that most residents support enhanced measures locally for all public venues. So I'd like to extend my sincere thanks to our sports leagues and other recreational groups for their leadership in bringing immunization mandates to their members. While we anticipate that there may be a provincial announcement soon regarding moving on from step 3, we can still expect that some public health measures will remain in place, and they are likely to include the proof of vaccination requirements in high-risk settings, continued mask wearing until we know we are finished with this pandemic, and a continued emphasis on increasing the vaccination rates, including boosters for some people, as we move forward. The reason that provincial case numbers are manageable are precisely because these public health measures are in place, and to relax them too much could very easily lead to the challenging situations that we have already seen in other parts of Canada, such as New Brunswick and Saskatchewan. Proceeding slowly and cautiously is especially important as we head into the time of year when people gather more indoors for winter get-togethers and celebrations, often including vulnerable elderly people. So it's really important to remember that immunization helps protect individuals, but it is also critically important that everyone who is eligible for the vaccine should get it. We need as high coverage as possible so that the virus can no longer circulate in our communities and that the incidence can be controlled. It's our way out. So let's not squander our process by letting our guard down altogether. And I am deeply grateful to everyone and to all of you for continuing to follow public health measures so that we can protect ourselves and each other against the possible infection with coronavirus. Brittany, I'll stop there, and thank you very much for the chance to make these comments.
Thank you very, very much, Dr. Gemmell, and hopefully you can stay on the line for some media questions. Thank you. And before we do that, we're very fortunate to have our mayor, Diane Therrien, join us today. And I just wanted to extend an opportunity, Mayor Therrien, if you had any comments to share, you're welcome to, or if you just like to be available, and I'm happy to put you on screen if that works for you.
Yeah, thanks, Brittany. I don't have a formal update, so I'll just stay on the line if there are questions. Thank you.
Okay, great. Thanks so much. Okay, well then let's hear from our media partners, and thank you all for joining us again. So in addition to Dr. Gemmell, I'm also pleased to share that we have Julie Ingram, our Manager of Environmental Health, who also oversees our inspection operation and enforcement work. So she's available. And we also have with us Inspector John Lyons from the Peterborough Police. So if there's questions on the enforcement side, feel free to ask those. So let's start with Reg Watson from the Examiner. If you've got some questions, please go ahead, Reg. Maybe he's on mute. Maybe we, oh. Are you there, Reg?
I seem to be on mute.
Oh, I hear you now.
Okay. I was going to pass it on to my colleague, Bill Hodgins at Peterborough this week.
Oh, okay, great. Well, then go ahead, Bill.
Hi, sorry. I really just one question. I was trying to find this on the website and I wasn't able to see it. Is there a rough idea how many people are still going in for tests on a weekly basis average compared to when numbers were much higher testing wise?
I wonder if, Donna, would you have access to this, or perhaps this is something we can come back to if not? Go ahead, Donna.
I know that the latest reports, I think there were about 1,400 tests being submitted locally, or 1,400 swabs being submitted locally each week. That is down from 2,000 earlier in September. I can't compare to like last year or like during the third wave.
And where are most of the tests being done?
Well, this time round, a large proportion of them are with school cohorts. So we've been working with Ontario East to engage a third party to do them. And then, of course, the assessment center continues to work, be open 7 days a week for testing.
Okay, that's all I have. Thank you.
Okay, great. Thank you, Bill. All right, Paul Rellinger is with us from Kawartha Now. So I'm sure you've got some good questions for us, Paul. Go right ahead.
I have questions, whether they're good ones or not, I guess is open to debate. Yeah, for Dr. Gemmell, if I could. A couple things, and then I had a question for Julie as well.
Okay.
Afterwards. Hi, Dr. Gemmell, how are you?
Not bad, Paul. How are you doing?
Very good, thank you. I wanted to get a sense, we've heard much talk, as you know, about the next phase of vaccinations for that 5 to 11-year-old group. And I'm just trying to get a sense of, is the local health unit kind of on go for when that is, when a vaccine is approved, and like how quick can you mobilize and get that going?
Well, Donna may have more detail on this, but let me just say this, Paul. Number one, as I said in my remarks, the key to get out of this and to get back to normal and to get coronavirus kind of a controlled, sort of a more regular annual virus is getting the coverage rate up, getting enough people immune out there so that this virus cannot circulate. And that we can then therefore keep the cases down so that it becomes more of a routine winter virus than this pandemic stuff that's going on. To do that, we have to get the coverage up. And right now, as you saw, we've got good coverage amongst the eligible people, but that key part, 5 to 11s, is are going to be extremely important to get done as quickly as we can, but also from the point of view of making sure the schools are even better protected than they are now. Immunization is a key public health measure that will make the schools even safer than they are at this point in time. So although I don't have details about exactly how this will be rolling out, we still have some discussions to do. It is going to be a main priority, and B, will involve not only Peterborough Public Health, but our partners as well, because we want to get this done as quickly as possible. You're right. You heard from Mayor Mitchell that there are about 9,000 students out there. I'm hoping once we get approval from the regulators and vaccine in the freezers that it won't take too long, but it will be a priority. The timing, of course, is critical because right now we're in the middle of, I should say, beginning the influenza immunization. And also we're starting to do boosters for other groups like retirement homes, long-term care, and so on. So yes, there's lots going on, but for the reasons I mentioned, those kids have to be a priority for us. I hope that answers the question, and we are going to make sure they get done as fast as we can.
That's a great help, and I may circle back to Donna yet on that same question if I could, but I had a couple more questions for yourself. If I heard right, there are 5,000 residents who are eligible for a vaccination that have not started the vaccination process. Without trying to be too much of a gloomy Gus, when do we resign ourselves to the fact that a good number of those, I'm assuming, just aren't going to get vaccinated? And what does that mean? I mean, they've had months to start that process. And I don't know, maybe I'm more of a cynic, but if they haven't started by now, they just may never get vaccinated. And what does that mean?
Well, first of all, it is disappointing, Paul, because it does reduce our coverage rate. And as I mentioned before, coverage is key to keeping this virus from being able to circulate in the community. I personally feel, as I alluded to, and I'll say it very specifically right now, that I think it's actually not only is it important for each of us to get the vaccine, but it's almost a duty for us to do so, to come together as a community to stop this virus from circulating. The irony of this, of course, is that we have two groups of people in the community. First group is those who all want the vaccine on the very first day, which of course is logistically impossible. And then there's the group that are either hesitant or resistant. There are, I know that there's many, I should say, interventions out there to try to get this up as high as possible. We hope that one of the side benefits, not the rationale for it, but one of the side benefits, because the rationale of requiring immunization to participate in restaurants or sports or whatever it might be, the rationale is to keep those places safe. But a side benefit may be to give some people who are hesitant some impetus to get the immunization done. As you know, it's not mandatory. Nobody has to take this vaccine, but perhaps as people see that their activities will be significantly restricted if they aren't immunized, it may give some people the impetus to go ahead and do this. And frankly, I think that during this winter, people who are not immunized may find themselves perhaps a bit more isolated, and it may be a continued more difficult time for them than people who have taken the vaccine. So there's lots of good reasons, individually and from the community point of view, to do so. We've got educational things going on out there, trying to reinforce the fact that these vaccines are safe, they are effective. They actually, to me, are a miracle, because this time last year we didn't have this vaccine, and now we've got a vaccine with coverage well over 80%, as you saw, which is with 95% effectiveness. I mean, even the flu vaccine can't boast that level of effectiveness. So we really have been blessed by the technology and the smart scientists out there who have made this possible. I just can't say strongly enough that to people, if you have, as Mayor Mitchell already has said, if you have not got the vaccine, please get good information. Please get reliable information, not from some social media sources that are simply trying to play games out there and create distrust or confusion in the population. The vaccine is safe and effective, and we all need to do our part to make our communities as safe as possible by getting immunized. Thanks, Paul.
No, thank you so much. And just one more thing, Dr. Gemmell.
Sure.
A totally unfair question, so pardon me for asking, but you know, we're in a fourth wave now. The potential, I suppose, is always there for a fifth wave looking forward. What's your confidence level in that not happening, just based on current trends that we've seen? Do you feel we're in a good place right now to avoid that, or?
Yeah, Paul, this is not an unfair question. This is actually a critically important question. We are right now, if you look at the numbers in Ontario and in Peterborough, we're in pretty darn good shape. I think it was, I haven't got the number for today, but I think it was 302 or something and 360 the day before. These are remarkably low. And it's because we've got good immunization coverage. We've got people using masks and the social distancing, and now we've got the requirement for immunization to do things. This is really very happy news for the moment. But the thing about this virus that we can never, ever forget is that it can turn on a dime and turn things dramatically worse, as has happened in Saskatchewan and in New Brunswick. I think people in Saskatchewan are very surprised. Excuse me. I think that people in Saskatchewan are very surprised that when they thought that they were out of this and that they could stop using their masks, and the next thing you know, you've got people being transferred to Ontario because they are ICUs cannot accommodate this. I think what people have to realize is this thing, it's like a ground fire. It will keep popping up all over the place until we have full control. And we're way better than we were this time last year. We've got great compliance with the vaccine. We have policies in place that are meant to protect the population. But this thing will pop up wherever we let our guard down. And I can't wait for the day that we can say, it's all over. We can just relax now, take off your mask, but the day is not here yet. We have to keep these things in place, because even though we feel good today, I don't want a month from now to be saying, I wish we hadn't moved too fast. Thanks, Paul.
Excellent. Thank you so much, Doctor. If I could ask Donna to just comment a little further on the 5 to 11 vaccine plan. And I guess what I'm just trying to find out is where you're at in planning, and specifically, is it possible that you're planning for clinics, physical clinics in schools themselves, or like just where's that at?
Yeah, so we're just wrapping up our last mile of clinics, and which means that we have much of the infrastructure in place, including the spaces and the human health resources. And as you have alluded to, we have been in schools recently with 12 to 17-year-olds, and our local district school boards are encouraging us, and we are taking them up on the offer of planning clinics for the 5 to 11-year-olds in schools as well. The one thing that we will be putting back in place, the clinics up at this point have been walk-in clinics, so we will be setting up a booking system again, and that's anticipated to be ready to go at the beginning of November. And the booking system then allows us to plan longer appointment times for children and their parents, because it's not as easy maybe as somebody who's 60 goes in, rolls up their sleeve, and an appointment only needed to be 5 minutes. But we are going to double that time. So we are working with our local partners in primary care and schools, etc., and are actively planning for a child-friendly experience. And so there'll be information available for parents, and we're, of course, we do need to wait for the go-ahead from Health Canada and an updated, product monograph, because it will be a new formulation. It'll be a pediatric dose. So staff and will need to be trained, and we will need to have the most up-to-date information available for parents, so that they can discuss the vaccine with their children. But we are actively planning and in a good place. Thank you.
Thanks so much, Donna. And actually, I needed that child-friendly shot. I'm a bit of a needle phobe, so. I had one more question for Julie Ingram, if she's on the call. Hi, Julie.
Hey, Paul.
I just wanted to follow up on you had the investigation and fines were laid at Peterburger. I'm just wondering, it's the only way of really checking, I suppose, is are they playing nice now, or since then has everything been kind of calm there?
It's a great question, Paul. And what I can say to that is that our investigation is continuing. So watch our disclosure page. If additional enforcement action is taken, whether that's further charges or whether that's additional orders on the business, it would be disclosed on our COVID-19 disclosure page. But the investigation is continuing.
And just further to that, does that mean like dropping in, checking out what they're doing, or like physically?
Yeah, it's a good question. We have a variety of techniques that we use when we do investigate. So we do use secret diners. We do watch, social media, what's going on there. We conduct surveillance on premises. So there's a whole host of techniques that we use. Any one of those could be used as part of the investigation, and nothing's off the table.
Perfect, thank you. And just one more thing, are there any other investigations underway? Is everything pretty calm on that front, or?
Yeah, no, we have other investigations underway, especially for some of the businesses that we've received repeated complaints for. So those investigations are possibly in progress of happening or will be initiated shortly. What I can say is last week, our inspectors, we proactively and complaint response, we were at 26 different food premises specifically in relation to proof of vaccine inquiries or complaints complaints received, about 50% were fully compliant with the proof of vaccine requirements, which is fairly consistent with what I'm hearing is being reported for the rest of the province. So I'm encouraged by that 50% number. While I'd like to see it higher, we'll get there. I'm very confident that we'll get there. And especially with the rollout of the Verify Ontario app that businesses can use, I'm confident that that will make things easier for businesses. And the 50% is fully compliant. Other businesses, I commend their efforts for trying to do the right thing, and they maybe just needed mostly education to sort of tweak their procedures. So overall, we're seeing very good uptake with proof of vaccine requirements in Peterborough, but I do want the public to be assured that we are investigating premises that may not be compliant.
Perfect. Thanks so much, Julie. I apologize to all my media colleagues for overextending my 15 minutes of fame here, but thank you. And thank you very much, Brittany.
Thank you, Paul. That's great. Okay, so we have Matt Latour joining us from Oldies and Freak Radio. Do you have some questions for our speakers today?
I do. I just want to make sure everyone can hear me because I'm on a new computer today.
You sound great, Matt.
Awesome. For Dr. Ian Gamel, I've got a couple of questions and then one for Julie Ingram as well. I guess just generally, because this is our last briefing before Halloween, just some general, I guess, reminders and tips for people that are maybe having, whether it be a Halloween gathering or planning on going out trick-or-treating, how can they do so as safely as possible?
Well, there are lots of events coming up, whether it be Halloween, Remembrance Day, we're getting into the Christmas season as well. I think that the best advice I can give is, first of all, I think it's fine for kids to go from door to door. The safety things all need to be in place, that are always in place to make sure that kids are can be seen by motorists and this kind of thing. Probably best, I think, for sure for younger kids and maybe even the older ones, to have a little bit of parental guidance this year in case things are a little bit awkward at any particular place that they visit. We would encourage people not to sing songs for their treats, like has been in the past, that kids should wear a mask that is a proper mask, in addition to any mask that they may be wearing with their costume. So the costume mask is not enough. And we would strongly encourage people to clearly to wash their hands before they give away the candy, and to make sure that it's all wrapped candy rather than things that are not wrapped, so that all these things will reduce the risk of any kind of, how should we say, contamination of things that might pose risk to the kids. The most important way of transmitting the virus, of course, is by the respiratory route rather than things. And so the advice about the mask, keeping distance, not singing, and that kind of thing, I think is probably the more important things. But thanks for that question.
And my next question had to do with some of the public health measures, kind of like, I guess, more so masking. Do you think, or how long do you think it will be until we're at a point where the masking mandates will be able to be lifted? Do you think it's still a while away, or do you think that because numbers have kind of, I don't want to say evened out or plateaued, that we're maybe closer than a lot of people seem to think?
Yeah. Well, Matt, I think it's going to be a while yet for the reasons that I mentioned before. We're not out of the woods. We can't let down our guard at this point in time, because we'll see. It's always possible that things will go south if we do. And something, frankly, I think people are getting pretty used to this, and in a way, I think pretty comfortable. I think that the advice that we're going to need is advice from the epidemiologists and the science people that will advise our politicians about when it's time to do this. We're heading into the season of respiratory infections. So this is the prime season, over the winter into next early spring is the prime season for influenza virus, parainfluenza virus, respiratory syncytial virus, and now, of course, coronavirus. So I think that for all these reasons, I think that we're going to be having to follow these guidelines for a while longer, even perhaps if we at some point in time get out of step 3. So I would be encouraging people to carry on and to, how should we say, what is that? Keep calm and carry on was World War II expression they used to say, and I think that's where we are, Matt, now, until we get a strong indication scientifically from the experts that it's okay to start doing this. And please don't be surprised if it doesn't happen until next spring, even. Thanks, Matt.
Perfect. And my last question is for Julie Ingram. Almost kind of following up on what Paul was asking about the businesses and the vaccine certificates and whatnot. I know it's last case scenario, but is it possible that if there's continued defiance, like a restaurant could be boarded up like we saw with the local barbershop recently, or I guess earlier on this year?
Yeah, that's a good question, Matt. And yes, that is a possibility. Those that obviously would not be our first avenue to go down. We have other approaches that we do try first, including orders to close, or an order in the case of a food premises could require other things such as the closure, of specifically the indoor dining area. But if we do continue to see ongoing non-compliance, then that is a possibility that we would take further action and physically close a restaurant. Yes.
That's it for me. Thank you.
Great, thank you, and thank you, Julie and Dr. Gemmell. Reg, I see you've got a question, so if you'd like to circle back on one of the topics already addressed, and then we can move on to Jessica from Global News. Go ahead, Reg.
Yes, just following up with Dr. Gemmell. Maybe I missed it, but are you saying yes or no to the children saying trick or treat on Halloween night?
Oh, I don't. Thanks for the question. No, I don't see there's any harm in saying trick or treat. But if they have the masks in place, they keep their distance. I think it's probably best to go out with within families or vaccinated friends that perhaps are in the same cohort at school if the kids are old enough to be immunized. I think that some of us will say to kids, well, I'll give you a treat, but you have to sing me a song. I think we should probably leave that for this year because we know that singing is one of the things that may cause aerosolization. For kids to say trick or treat or just doing the doorbell, I think any of these things are okay as long as they're wearing the proper masks.
Okay, thank you very much.
Thank you.
Thank you. Thank you both. Okay, Jessica from Global News, go ahead if you've got some questions.
Thank you, Brittany. I do. I'm not sure if you have these numbers. I was on HKPR's call yesterday, just for kids under 12, what the case count has been. So I don't know if you have those numbers. I don't know who to ask for them. But I was wondering if we have any kind of stats on kids and the case count.
Our tracker does include cases, but the age bracket is 20 and under. So, but I can ask our epidemiologists if you're looking for 12 and under and this is case counts for the full pandemic since it started?
Yeah, the full pandemic would be great. Yesterday I got March to like from 2020 to today, but okay. Whatever you could provide would be great.
Sure, I can send you that in an email, Jessica.
Thanks. And then just a clarification on something I may have been mixed up. Now, I thought that Donna Cherapy said that our numbers are higher this year than last year, despite vaccinations. Is that correct?
Yep, that's correct. I'll pull up the slide so you can see that.
But then Dr. Gemmell said we're in a better place this year than we were last year. So I'm a little confused with that. I mean, obviously we have more people vaccinated, but if our case counts are higher this year, how are we in a better place?
Maybe I should clarify to say, that I think we could be in a lot worse place, Jessica. We've been through a winter time last year when we were getting thousands of cases per day. While the vaccines has been very helpful, the issue is that there's still that, 10 to 15, 20% that has not been immunized who's eligible. There's still the kids below 12, which represent another 12, 13% of the population, 9,000 kids. That means that we've still got lots of susceptibles out there, and this virus will go where there are susceptibles. So I'll perhaps you revise in what I said to say that because I didn't have the numbers for last year at my fingertips. But I will say that we could be in a way worse situation. All we have to do is look at some of the huge outbreaks that are occurring in other provinces in Canada to understand that we could be in one of those places where everyone's sweating because we just don't know whether our health system can keep this in place. So I apologize for the confusion, and I hope that nuance can clarify it for you. Thank you.
Thank you. And then I just had some other questions around enforcement, but Julie has answered those for PPH. Just turning to Inspector John Lyons. If you're still there, I know there was an incident Monday for someone was charged over, a masking incident. Have you been seeing, has Peterborough Police been seeing many of those? And have there been any more charges that I might have missed?
Yeah, and thank you for the question, Jessica. So that we actually have had 2 incidents. One was on Friday last week, which was the 15th of October, and it was there was 2 people in a lineup at a Water Street North business, a restaurant, and essentially what happened is there was one of the people that was in the line that was had an ill-fitting mask, and they were adjusting the mask, and the one individual didn't like that, and there was a confrontation, and there was an assault. It was the incident on Monday was at a business on Park Street North. An individual entered the store, was asked by the clerk to put a mask on, became irate, and ended up tossing some things about within the establishment. And subsequently, she also spit on a person that was walking into the business, and was charged accordingly. Those 2 incidents are not in any way associated. These would be, in my estimation, extreme examples of what's happened. We have not had many, to my recollection, events that have occurred that we could link criminality to a situation where somebody wasn't abiding by COVID rules. I know there's been a lot of cases where people have had conversations with each other. And I'll give you a prime example is in stores where, there's a way in which you can walk through the aisles, and I know people have confronted people, but again, there's never been anything that I'm aware of where it's risen to that level where it's actually a criminal act as opposed to just a minor agreement. So yeah, I don't see this as as something that's going to have an uptake. Again, 2 isolated incidents that just coincidentally happened within a few days of each other.
Okay, I didn't really even think of that, so thanks for pointing that out. If you went just for a call, if police went just for a call about not masking, that would be more of a provincial offense, right? And would that be more of a PPH's responsibility because there is no criminal aspect to it?
Well, not necessarily. We're all partners in enforcing the ROA and the EMCPA. And I will say that the PPH has taken on a very large role in dealing with a lot of the establishments, and I have to thank Julie for that. I think I owe her something for this down the road, but yeah, we've tended to share those duties amongst ourselves and city bylaw and PPH. In a lot of the cases, it's a case where enforcement isn't always issuing a ticket. Enforcement is going and trying to stop the behavior. So like if police attend and we speak to individuals about a situation, just because a ticket isn't laid doesn't mean that enforcement hasn't been done, because we're enforcing the actual legislation. And I think that we all do that. I think that we're all trying to, work people through the legislation and to be compliant. And I would have to say overall that we are very impressed with the city and the areas that we police, that people have been mostly compliant, and we've had very few large issues, I would say.
Thank you, Inspector Lyons, and thank you everyone else. That's it for me.
You're welcome, Jessica.
Great, thank you very, very much, everybody. I think that brings us to an end to our media guests, and unless there's any last minute questions, I think we are in good shape. Jessica, I will get back to you. I've already asked our epidemiologist for those case numbers for youth under 12, so expect an email from me soon. Thank you all very much for joining us, and stay safe out there. We'll see you again back here in 2 weeks. Thanks again. Bye-bye.